Do you ever get dizziness that just doesn't go away? You've been to multiple doctors, they all tell you that it's just in your head, you have stress, or you have anxiety. Maybe you were even in some sort of accident right before the dizziness happened that could have been months or even years ago. And you went to the hospital, they took x-rays, they did an MRI, they said everything was normal and that you would be fine. But ever since then, something's felt off. You constantly get dizzy. Every time you turn your neck, you feel like you're going to fall over, and you just have these weird, unexplained symptoms, and you have no idea why. The worst part about this is so many doctors just keep telling you that you're fine and that it should just be going away, but it's not. Here's the thing, just because your x-rays and your MRIs are all normal, it doesn't mean that everything is actually normal. In this video, we're going to cover how the top part of the neck could be the culprit in some of these things like dizziness and what you can do to help. The top part of your neck, which is the C1 and the C2, the atlas and the axis, this area is way more important than most people realize. It's the most freely movable in the spine, but it makes it the most susceptible to injury. So that's how this area can become damaged or injured and cause dizziness, headaches, and things like that after some sort of accident, even if it was small. So the top two bones, it does way more than just hold up your head. It plays a major role in balance. It tells your brain where your head is positioned, and it helps control even eye movement and coordination. It's constantly sending signals to your brain. It's kind of like your phone's GPS. It's updating directions as you move. Now imagine you're on the highway, your GPS glitches out, you have no idea what's going on, you get confused, you don't know what to do, and then it ends up causing a traffic jam. So this is what happens whenever your upper neck isn't functioning the way that it should. Your brain, it gets bad information or the wrong information, and now you have things like dizziness, headaches, and it all just started possibly from that accident that you had a few years ago. So what exactly happens to your neck in a car accident? Even in the low speed ones, the whip-like motion of your head, it can throw off this entire system. The upper neck, it might get stuck in position, then it can't move properly. The signals that get sent to your brain, they start getting scrambled, and now your brain, it has to work overtime in order to just process the normal movement where it should be able to do it really easily. Here's where it can get even worse. Your brain is like a supercomputer. It's constantly processing signals to and from your body. So when the upper neck is sending signals to the brain, everything works good. You don't feel dizzy, you feel balanced, you don't have headaches. But when those signals, when they get distorted, it's like radio static. Your brain has to work way harder to like hear it in a sense, and it has to figure out what's going on. So that's whenever you can start noticing the dizziness, whenever you turn your head, whenever you might feel lightheaded, whenever you look up or down, and even a weird floaty sensation sometimes whenever you walk. Here's the frustrating part. It doesn't always show up right away. Sometimes it can take weeks, months, or even years after an accident before you notice this dizziness come on. Because it doesn't happen immediately, most people are never going to connect the dots that an accident many years ago actually was the cause of what they're feeling today. So let's talk about a real example of this. So this happens a lot more than you might think. So a patient came in, we're going to call her Sarah. She had a minor car accident about 6 months ago. She felt a little sore afterwards, but it was nothing crazy. She just assumed it was going to go away. A few weeks later, she started feeling off balance randomly throughout the day. Didn't know why. She felt lightheaded. She almost felt like her head was too heavy sometimes. She went to the doctor. Blood work was all normal. Heart test normal. X-rays normal. Everything she was told is normal. She's all good. She just has some anxiety, some stress going on in her life, and that was probably causing the dizziness. So she came into our office because she was still suffering, and we did some exams on her. We did a 3D CBCT scan of her, and we found that there was something going on in the neck, and that the signals that were being sent to her brain were incorrect. So this was causing some of her dizziness and the disequilibrium that she was feeling. So we started adjusting her, started normalizing that input coming from the neck to the brain. Now dizziness has almost completely disappeared. She's no longer having as much episodes and is doing much better just after a few weeks of treatment. So the question I get a lot is, why haven't I heard about this before? Why haven't I heard about cervical chiropractic? Why haven't I heard about, adjustments helping with dizziness, or that, your neck could be causing dizziness? So a lot of the time, whenever people, they go to the hospital after a car accident, they're looking for big, obvious injuries, fractures, brain bleeds, or anything that's life-threatening. That's a good thing. You want them to look for those things. You don't want anything severe going on. They're not looking for any sorts of minor dysfunction, things that might not be obvious, but they still could be affecting you. So if the tests do come back clear, it's actually really good news. It just means that we have to look deeper at those areas that aren't as obvious. This is why many people will spend years and years and years in healthcare and in the medical system, because they're just searching for answers and they're looking in the wrong place, frankly. Key to fixing some of this, you don't want to just treat the symptoms. You want to restore proper function to the neck if there is dysfunction that's going on there. I want to be clear, not all dizziness is caused by the neck. There are certain types in certain cases where it is, but not all of it is. You can have inner ear problems, you can have eye problems. All of these systems are in constant communication with each other. So there can be dysfunction in other parts of the systems too that cause dizziness. If you've done vestibular therapy, you went to the ENT and you went to vision therapy and none of that really worked, then looking to the neck, that's probably your next step that you want to take to see if that's causing your dizziness. So whenever we get this area working properly again, your brain starts to process the balance and movement correctly, you reduce the dizziness, you feel better as you're moving, and overall, like you just feel more stable. So, like I just talked about, a lot of times people assume dizziness is some sort of inner ear or eye problem, and I've had many patients come in and tell me they just feel like they have to live with this. That they've been suffering for years and years, and they found no answers. But there's always something more you can try. I know that it's exhausting, and I know it's hard. Don't give up hope. Really, don't give up hope. If you like this video, like, comment, subscribe. I answer any questions down in the comments below, and we'd love to help you if you feel like there's something going on in your neck that's causing your dizziness.